solutions for eliminating symptoms, which was how I had been using it. When combined with mindfulness practices, it could also address questions of meaning, purpose, and even spiritual peace. That is quite a claim, I know. But be assured, this is not one of those books by some self-designated guru who claims to have finally figured out the secret of the universe and wants people to follow behind. I am by no means the first person to walk this road. My goal, instead, is to simplify the process that I found to be so incredibly helpful so that as many people as possible can experience it for themselves. This life-changing approach can be summarized in 3 words, making it easy to remember on the fly when you need it. Think, act, be. Descent. I was motivated to become a psychologist in part by what I knew of my grandfather's emotional struggles and his suicide 8 years before I was born. Frank Roland Gillihan was haunted by horrific memories of naval combat in the South Pacific during World War II. I wondered what his life would have been like if he had gotten effective psychological treatment. Maybe he would have lived to meet his grandchildren. His only child, my father, would have been spared the pain of losing his dad to suicide. That pain was a felt presence throughout my childhood, often apparent in my dad's irritability and temper. At other times, it was raw grief, such as when I was 8 and walked in on my parents in our laundry room. My mom had her arm around my dad as he sobbed, a stack of old family photos in his hand. I did my training at the University of Pennsylvania, the birthplace of many CBT treatment programs. The faculty were deeply engaged in developing short-term, effective treatments and testing them in rigorous clinical trials, and my faith in the power of CBT deepened as I witnessed its effects firsthand. I saw the power of thoughts to affect our emotions. I learned how simple changes in our actions can boost mood and bring greater fulfillment. I continued at Penn after I graduated and took a faculty position in an anxiety research center, where I oversaw a treatment study of CBT for post-traumatic stress disorder, PTSD. Participants came from the surrounding community and the local Veterans Affairs Hospital, men and women haunted by traumatic memories of violence and pain. After the 12-session protocol, many were transformed, freed from nightmares and flashbacks, and ready to live their lives again. I often thought of my grandfather. When I left Penn and opened a solo private practice, I continued to offer CBT. It was exhilarating to see the dramatic effects that a few sessions, sometimes just 5 or 6, could have on a person's life. The grip of anxiety would loosen, depression would lift, sleep would improve. My schedule quickly filled with people who wanted an action-focused way to feel better. But as I continued to practice, I was often struck by changes my patients were experiencing that seemed to transcend simple symptom reduction. People described feeling lighter, freer, more connected to a version of themselves that they liked. Their family members told me with tears in their eyes that they finally had their loved ones back. I wasn't sure what to make of these changes, since they didn't fit neatly with my CBT view of therapy that focused on measurable outcomes. At times, I even envied the deep work they were doing and the new levels of peace and happiness that they'd found. I was especially struck by the deep changes I saw with Paul, a young dad who was out of work. His childhood had been tough, and Paul had hated himself for as long as he could remember. His father had left the family when Paul was 5, and Paul always felt that he was his mom's least favorite child. He had battled alcohol addiction early in his life and had struggled in his closest relationships. Paul's biggest challenge was feeling like a failure to his young daughter and son. He'd been deeply wounded by his dad's departure and had always vowed he'd be a father his children could be proud of. With his job loss and the depression that followed, he thought they must see him as a pathetic disappointment. He choked on the words every time he tried to talk about disappointing his kids, but would wave off the tissue I offered. His shame would quickly turn to anger at himself for being a crybaby, as he roughly brushed away the tears with the heel of his hand. Paul denied being an imminent threat to himself, but said he often imagined ending his life. We had worked together for many months, longer than a textbook course of CBT.